Welcome to the NSK podcast series. I'm Siohban Kelleher, the Clinical Support Advisor for NSK, and I'm joined today by the lovely Jacqui Armstrong. Good morning, Jacqui.
Good morning. I'm Jacqui and I am the owner of Oral Health Hygienists Limited in Scotland.
It's fantastic to have you, and thank you for doing this podcast to enlighten us all about your journey so far in your fabulous new practice. Where did you come up with the name Jacqui O?
I came up with the name in my hot tub
In the hot tub.
After trying about 100 other names, but every time I Googled the name that I thought I had uniquely created, there was about 3 other practices that were already called that. So eventually, after a couple of hours of searching on Google for all of my what I thought were unique names, I thought, what if I done a bit of a play on words, and rather than being dental hygienist, if I changed it to oral health hygienist, then I could have the acronym O, and then we could tie it in with "Oh, hello, gorgeous," oral health hygienist, and sort of play around with that title a bit. And thankfully, nobody else had done it, so we came up with a logo and had it all quickly trademarked.
So in 2013, the government changed the rules allowing the general public to access a dental hygienist directly without the need for a referral from a dentist.
I was really excited about this because I really do feel at that time in 2013, I was working for a large corporate. And I thought this was going to be a great platform where, we could have this direct access model. And, dentist, for me, a dentist is very curative. They have 5 years of trying to do everything in dentistry and then trying to excel in all of that. Whereas as a hygienist, we are more, promoting health, preventing disease, know a lot about mouthwashes and toothpaste and everything else that dentists just don't have time to learn about or know about. And I thought this was a great route that was opening up. But then at the time, the large corporate had a very, very good head office team, and the chief exec was a lovely guy. And he had come around all the practices to visit us. And when he came, he asked me about direct access. And the whole head office team were very against it. They thought it was a mistake. They thought they didn't think that it should be allowed to go ahead. They weren't keen to promote it. And we had, luckily, they were lovely. And we had quite a few hours of a chat over the next week while they were in Scotland. And I was given direct email access to the head office team, to the chief exec, and actually changed his mind on it, because it's still to this day, I don't think it's fully understood. I don't know if it's fully understood how qualified we are as hygienists and therapists in diagnosis, in promoting health and preventing disease, in oral cancer screening. And I think unless there's more education about that within our own dental worlds, that we're never going to get the message out there, that it's the old twin set and pedals thing still seems to sort of linger on, helping the dentist. And that's not where we're at. We're standalone professionals in their own right who are very, very highly trained. So luckily they did change their mind on that back then. But even at the very start, it was a battle. And they kind of gave us direct access, gave us our wings and said, off you go, fly, and then tethered us to a post with prescribing rights, which hopefully, is now about to change. But how can you give someone direct access, but still we're not allowed to make decisions, on fluoride application or, local anaesthetic? And it just, so we've got direct access, but slightly tethered.
Yeah, we're getting there, aren't we?
Yes, we are getting there.
Dental hygiene is clearly your passion, Jacqui. Tell us more about your day-to-day work and what services you provide at O.
So I have I've never just thought of it as being dental hygiene. My sort of mantra or motto or whatever, ever since I've become a hygienist, is really whole health, not just oral health. You know, the mouth is the top of the gut. It's the access to the digestive system. It's the access to the respiratory system. You know, 90%, over 90% of systemic disease is linked, strongly linked to the health of the mouth, the health of the gums. So I used to teach, and I think all of us in our roles are educators at the baseline of anything. So in my day-to-day role, I've never seen it about sort of cleaning teeth, or, you know, I've seen it about educating and about whole health, not just oral health. O is skin and smiles, because, you know, the gut is the second brain. You know, there's more nerve endings in the gut than there is in the spinal cord. And if the gut isn't working properly, then the skin reacts. You know, it's the largest organ, it will try and take over. So very much O is about skin and smiles, because we are about the gut at the end of the day, and educating patients to make them healthier. So my day-to-day work has become delightful, because I've been 32 years in dentistry. And I've been on that hamster wheel, which a lot of us have been on, where it's production line clinic that we kind of run. You know, you're trying to almost do the greater good for the masses, and are unable to actually tailor and have no time constraints with each patient. And now I have that, you know, I've been able to create that by having my own practice. So we are solely promoting health, preventing disease. Every patient's treatment on that day is tailored to them and where it leads us. Obviously there is the element, you know, of dental hygiene in it, but it's more than, I think dental hygiene is more than that. Being a dental hygienist or being a dental therapist, as anybody who has done the training and is doing the job, you know, we are more than just what people perceive of sort of cleaning teeth. You know, we're educators, we're counsellors a lot of the time as well, added into the bargain. And having my own practice, I'm just able to really embrace that.
And just going back to when you set up, what were the challenges that you faced, and what are the challenges maybe that you see going forward?
If you ask anybody, dentist or hygienist who has opened a squat practice, I mean, you've got to be slightly mental to open a squat practice. You know, it's fortunately for a lot of dentists, you know, they can buy over or you know, tiptoe in as an associate and then maybe buy over an existing practice, or they can buy over the goodwill of the practice. Even corporates who are buying up lots of different practices, you know, it's very much about the goodwill, what they're buying into, and keeping things ticking over. But a squat practice, the challenges for anybody, be it dentist or dental hygienist, are immense, but worth it, you know. And that's probably the question that should be asked, rather than what were your challenges. There were many, but were they worth it? Yeah, you've just got to get your head down and kind of tiptoe if you must, you know, but just start in that direction. One of the challenges, taking away the sort of squat practice element, one of the challenges is, again, I don't think direct access is fully understood within the profession and within the trade. My biggest challenge wasn't really the setting up of a squat practice, because I knew what I was taking on. I knew I was going to open with 0 patients in the book. My issues were when I was reaching out to trade to set up my accounts and to organise my supplies of my stock. They were not knowledgeable about the fact that I could, as a dental hygienist, open my own practice. And everyone kept asking, and how many dentists am I employing, and how could I possibly work without a dentist? And there was no understanding of patient group directives, or it was quite a hard battle. And even now, when there's new account managers that come in, I'm being questioned again as to, you know, how many dentists I have, and how am I just on my own. And I think it's a shame, and it'll hopefully get easier now that, you know, there's more of us sort of opening, and hopefully more will open.
And was that just to open an account, Jacqui?
to open an account. And I'd also suffered some discrimination as well with one of the large equipment suppliers, which they wouldn't give me the same terms as they would dentists, because I was only a hygienist, even though I was a hygienist who has been, I'm ex-army dental corps. So I came out of dental corps in 2003, and I've been a self-employed hygienist since 2003. So I had all my records back, going back to then. And I'm, I'm 50 next year, so I've got a secure, my credit rating is very good, let's say, I have a very secure background, more secure than, maybe a young dentist who was coming out after studying or whatever. But there was a lot of discrimination. I did receive an apology because of the discrimination, but it didn't change anything. But there was discrimination, and that's where the challenge is. I think it's not so much, you maybe expect challenges out with our own network, but the dental network is such a small network, especially in Scotland. There's only 1,000 dental practices, and it would be nice if amongst the trade and amongst everybody there was a bit more camaraderie, a bit more support for direct access dental hygienists, which there isn't at the moment. Things take a while to change.
They do.
But,
yeah.
and hopefully.
Do you think more hygienists will opt to open in a practice, and why do you think so few have opened so far?
I think it is just, it's very difficult. I think you've got to really want it. And I also think you've got to have the right team behind you. I am in an extremely fortunate situation because I have a very, very tolerant husband who knows that I love my job. And along with that, I have 3 daughters who, know that I love my job. They know I love skin, they know I love teeth. And they are my team. On top of that, my dental nurse, my qualified dental nurse who I have, has nursed with me for many years. So if the team's strong behind you, then on the days where you're thinking, especially in the beginning, when you're thinking, have I done the right thing? Is this worth it? They're sort of championing you on, they're like cheerleaders in the background, and they're going, well, this is, this will be hard just now, but it's going to get better.
And what about the patients? How do they react coming to a hygiene only practice?
The patients, I'm going to use the word love, because all of my patients who come here love coming into the practice. They really feel like they're part of the feedback that I get, and the reviews that I get, and the fact that anybody who's stepped foot through the door comes back. There isn't anybody who's coming into that hasn't come back. It's different to a dental practice. In a dental practice, everything's just so busy. Reception's always so busy. The phones are always ringing. You have the dentist drills sort of going. There's certain smells that accumulate in a normal dental practice. It has to run in a certain way. A standalone dental hygiene practice is just light years away from that. This place that I've set up here, there isn't any of that going on. Because we're private, we can't access funding on the NHS, so we are private. And with that comes that element of that patient journey where they are arriving on their own. They're arriving, there's no crossover, especially with COVID. That it almost reinforced that, really, that there would be no crossover. So they arrive, everything is tailored to them. Everyone always says when they come in, you don't smell like a dental practice, and it doesn't look like a dental practice. We have the dental chair and everything in the room, but the whole setup is just slightly different. There isn't, we aren't time constrained the same as I was in other people's practices, and separate it into sort of curative, and promoting health, preventing disease, implants to specialist endodontics. Why are we so delayed in specialising to, and I'm not talking about high-end perio. I mean, I was one of the staff dental hygienists in Glasgow Dental Hospital for a number of years and used to teach in there as well. So yeah, you know, high-end non-surgical periodontal therapy was my thing, but I'm not even talking about that. I'm talking about the stages before that, preventing getting there.
So you're kind of saying a restructure, because I suppose the profession's only about 100 years old, isn't it?
Yeah.
And originally it was designed that we were supposed to go out into the community, but then I don't think the practices knew what to do with us. And then we just kind of got put into surgeries and got a ref S&P, and that was that.
Yeah.
And it kind of fumbled along, didn't it? But it definitely has. You can see where practices where they have structure works really well. But now this whole other area is just very exciting, isn't it? Just to bring that forward.
I think the more that people know about the links with systemic health, I mean, every time I talk about that, people are shocked that, you know, that they don't know more about it. I think were the United Nations not about to do a 3-year charter on education about oral health and how it's affecting the world and how it's like a massive problem? And then COVID hit and it all got shelved. There was something, wasn't there, that they were doing?
Yeah, because I know the BSB and Europerio do try and do things every so often, don't they? But I think the government needs to probably step in and give that drip effect, don't they, you know, across the board. What about the practices around you? How supportive have they been?
So if we split it into dental practices that know me and that I've had the pleasure of working in, are very supportive, and we have a good relationship with me being able to refer, because I get so many patients who aren't registered with a dentist or, you know, need certain things, and I have a very good relationship with practices where I have worked and they know me well, and I would consider them friends, you know, rather than just colleagues. And they are who I refer things to, but they are not in my local area. I have done locum, and I have family members who work in local dental practices. And there's now 10 local dental practices in my area. And I was not received well in the beginning. I hamper dropped them all. I took them all lovely hampers and introduced myself and said, by the way, I'm opening a dental hygiene practice. And it wasn't well received in the beginning. Now, there is a change in this. There's maybe a slightly more Disney than Shakespeare ending to this tale. So in the beginning, I would, especially when the practices still weren't seeing people for routine care, and I would have one of their patients as my patient, and there would be something that wasn't routine care that needed addressed, and I would email the practice and say, well, you know, your patient has presented to me with X, Y, and Z, and I would remember my place. I'm ex-army, I was a corporal in the army. I know how to remember my place in the structure of the world. So I would be ignored. And when the patient would eventually go along to the practice, they would say, oh yeah, we got our email, or, you know, yeah, we received our message, but they wouldn't correspond with me. They wouldn't correspond with me. And I was just saying, you know, I could do this and I could do that, but I don't want to, you know, step on any toes or whatever. Or can you see this person? However, and there was other things that happened. Patients would come back to me and they would tell me tales of things. And over the past, so we'll have been opened a year in June, and over the past few months, just the past few months, I'm actually getting patients that are saying to me, I had a checkup with my dentist and they said my mouth's the healthiest it's ever looked, and asked me what I'm doing. And I said, I'm going to Jacqui. And they're like, oh, excellent. Well, you know, everything's looking fabulous. So yeah, you should continue to do that. But that has been sort of 9 months of, I don't know, I think, again, it's that educating the profession. You know, I'm not here to catch anybody out. I'm just here to, you know, promote health, prevent disease, and work in tandem with the rest of the profession. But I don't know if sometimes, or this, whether we're perceived as, I don't know, a bit of a threat. We're not really taking out bread from anybody's table. We're just running a standalone service, which at the end of the day helps patients in the long term, and dentists, because there aren't that many dentists that want to deal with perio. They would rather deal with the more exciting, things.
Yeah, well,
So,
definitely the most skilled dentists that I've worked with down through the years, they want that lovely healthy mouth to start working on, don't they?
Yeah.
Tell us about equipment. Do you have some NSK products, do you? And why did you select the NSK equipment, and what are the benefits to you?
I love NSK. For a couple of different reasons, I have to say. So back when I first trained as a hygienist, we had a Profimate in the cupboard that kind of needed dusted off, to use. And I kind of dusted it off. I was like, I'm having a shot at this. And basically since then, I've never been without one. Why would you? Why would you do, the old school polish when we have this amazing piece of kit, which the patients love once they realize, the benefits that they're getting from it. Anyway, NSK was what I was first introduced to. And when I came out the army and was back working in Civvy Street, the NSK rep for Scotland, Angela Glasgow, is absolutely fantastic. She's like Wonder Woman. Yeah. Anything that you need, she, to her detriment, is on the other end of the phone. And I've had a few incidences where my nurse has dropped my handpiece and it's had to go for repair, and being self-employed, that's devastating to me if then my full clinic is at jeopardy because we don't have enough handpieces to get through the day. And Angela would be there on her white horse with her loan equipment while my equipment was repaired. The service with NSK, the relationship and the kind of customer service that you have is just second to none. I have loads of lovely relationships with lots of suppliers in dentistry and lots of reps, but I have to say the NSK customer service is just second to none. And that also probably factored into the fact that I also love the equipment. Opening I was able to have a say in what was put in my surgery, which I've never been able to have before. I've worked with lovely dentists, but they've been very specific about having a bobcat or something, and they're like, we've always had bobcats and this is just what we do. And I've got an NSK Various, I have the Profimate, and I have the Perio-Mate, and they're fab because I am on my own in here. And especially opening a squat practice, I had to consider cost effectiveness of everything. And I have them as they're standalone systems. So if something breaks down, it's not that I'm losing everything for that period of time.
Interesting, yes.
I do have a backup, my sort of bracket table does have a backup satellite scaler on it. But whilst Angela is still working for NSK, I know that even if anything did break, I should be sorting out straight away with sort of loan equipment while it went off to be repaired. I also find it all very robust. I have used so many air polishing systems over the years, and I love my Profimate. I mean, I have only used that for every single appointment I have had since about 2003. And they're really easy to care for. They're just a fab bit of kit, really. And the Various, when I changed from Cavitron, it was different. Initially, I was like, right, this is a different movement I'm having to use here. It was a little bit of just switching over in my head a little bit to how I was utilising the equipment. But I have to say, and I'll say this and you might need to edit it out, but I was cleaning the distal of an upper left 8 And I've got my loops, I've got my light. Obviously, it's got the fibre optic on it as well, which is amazing, absolutely
Yes,
amazing. And there was a big chunk, of calculus up there. And as I removed it, the handpiece, well, the tip fed back, like it gives you feedback of the surface
feedback
that you're on.
loop. Yes.
So as I removed it, I suddenly, from the vibration and the sound, I knew that the enamel wasn't sound under that large chunk of calculus, because it fed back to me immediately that I was on a different surface. And that is amazing, because my vision was pretty good, but it was like a nanosecond, straight away I could pick up, oh, hold on a second, the vibrations changed here. And then I stopped what I was doing, cleared the area, and there was a cavity under underneath that tartar. I wouldn't have got that with anything else. And I thought, this is an amazing bit of kit that I have in my hand here. That if you're tuned into it, and paying attention to it, it will, it adjusts. It tells you when there's something that isn't right.
Fantastic.
Is that correct though?
Yeah, this is the piezo engine. There is a feedback loop.
Yeah, it was really, I thought that's brilliant that we have that, because if you're in tune with your instrument, then it's just giving you so much information.
What are your future dreams, or are you already living the dream, Jacqui?
My initial future dreams is, I really hope we get prescribing rights. That would take a load off. So first off would be for us to get our prescribing rights. Second would be for a bit more recognition as our own, side of the profession. A bit more recognition for what we actually know, because we're quite clever, us lot, and we're quite useful. And then for it to become easier for more hygienists to open their own practice. My future dream would be that dental hygiene was standalone. Like podiatrists are from doctors, like opticians are, like, we are slightly different. Dentistry's, to me, is like sport, and you've got football and you've got rugby, and they're one and the same, with the same sort of, scoring endpoints, but really two completely different routes. And I think that needs to be identified now. Long gone are the old days of hygienists being there to help the dentist, and it's not that anymore. And people are living longer. We have so much more disease occurring. And, like I said at the start, the gut is the second brain and the mouth is the top of the gut. So really, our role in promoting health and preventing disease, and my wee thing of whole health, not just oral health, that's really where my dream would be in the future, that we had standalone hygiene practices who were totally focused on promoting health and preventing disease.
Jacqui, thank you so much for sharing your journey with us this morning. This is Jacqui Armstrong from Oral Health Hygienist, which is O. I absolutely love it. This is the NSK podcast series. Join us for more in the future. Thank you very much.
Thank you.